California Pediatrics, a podcast by pediatricians from the 4 California chapters of the American Academy of Pediatrics, AAP California Chapter 1, 2, 3, and 4. 4 chapters, 1 state, 1 voice. In 4, 3, 2, 1.
Hi, I'm Grant Chrisman. I'm a pediatric hospitalist.
Hi, I'm Melissa Ruiz. I'm an outpatient pediatrician, and welcome to California Pediatrics, where we're going to talk about ways to keep your kids healthy, all kids healthy.
And we're also going to talk about how our guests got to where they are today.
And today, on our podcast, we have Dr. Ilan Shapiro. Welcome.
Thank you very much. It's a pleasure and an honor to be with both of you.
Do you want to start?
Sure. So, the first part of what we really want to get to is how you got to the position that you're in. So I guess it'd be great to hear a little bit about what you do and what where your passions lie.
I love that question. I was born and raised in a small city called Mexico City. We are right now around 24 million people. And I got to see the difference between, Pueblito, like a little town healthcare system, and also a big city system. And I also saw the difference between one place or another, and there were a lot of things that are very, very in common. If you actually take care of the kids, you have a better community. If you actually give them, it's not about millions of dollars, but if you give them a safe space to grow in an environment where they feel safe and healthy, that actually helps not only the child, but also the family and the community. Sure. Then that was part of the things that I learned in Mexico. I had the pleasure to work as the liaison between Mexico and the WHO. I loved it. Then I not only saw the pueblitos and all the crazy stuff that was happening in different places, but I also saw how communities and countries treated each other and how we needed to actually create those bridges to create a better future for our community. Following that path, I ended up doing my pediatric residency in Chicago at Mount Sinai Hospital. Loved it. And I never, and this is actually quite one of the funny stories, I have never seen something called snow before that. Then one of the tips that they actually gave me at that moment was that do not touch anything that it's not white snow and never put it in your mouth. Then I learned very quickly about how to actually dress up in winter, making sure that we were taking care of each other. And suddenly, at that moment in Chicago, I started hearing something about the H1N1 and the influenza and this thing about mutating and jumping. Then I was a pediatric resident. I saw what was actually happening on the community. There was a lot of misinformation, disinformation. People were not coming to the clinics. People were not, understanding how to prevent a lot of the things that we could prevent. Then, at that moment, I understood that there was a huge important component there as a pediatrician to create conversations. And let me tell you why. At the moment that I was seeing my patients, and I could see like 20 plus patients in my outpatient clinic.
As a resident?
As a resident, yeah, that was the outpatient clinic the entire day. That was around 20. And the interesting part was that I was repeating myself. I was talking about influenza again and again and again, about medications, about vaccines, about other stuff. And I started doing the math. Then if I wanted to reach the 100,000 or 200,000 kids that I had in my area, I needed to actually be working there for a couple of 150 years, something like that, from Monday to Sunday. When I ran the numbers with my wife, she was not happy with it. Then I needed to find a way. And that way was actually media and social media that was actually on the start of this thing. Yeah. Then that actually created the messaging and the opportunity to have a pediatrician or a physician actually having that conversations with the community.
Yeah, absolutely. I think we might have been in Chicago around the same time, by the way. I also trained in Chicago.
Oh, nice.
So you started kind of at the beginning of the social media movement, being a presence and a trusted presence. And kind of how has that evolved to now where social media is obviously blown up?
It was quite interesting because I have like two paths. One is actually like regular media, Univision, CNN, Telemundo, and all this stuff. But I never get feedback.
Yeah.
It's maybe in someone on the street or a patient, they go like, oh, I
Yeah.
heard whatever.
Right.
But in social media, there's that space where you can actually get immediate feedback. Doctor, you actually misspelled that word. Doctor, you did something different. And the thing that I'm trying to do, at least in social media, that in the English media it's already done, is that to convert a lot of the messaging for the community. And what do I mean with this? Is that the people that I serve have 2 or 3 jobs. They are running around. They have all these things around their lives, and actually getting information for them, it's hard because you're trying to survive and bringing the best thing for your kids. Then I'm trying to make sure that I'm creating small pockets of information that it's fun, reliable, and they get the option to choose. My opportunity as a pediatrician, as a physician, is to give the tools for the community to take the decisions that they want to take. It's an option, it's an opportunity. Have that conversation. I don't want them not to do something because they are afraid or because they lack information. I want them to actually get enough information to go like, well, at least I know where to get more information, or no, this is not for me.
Right.
And that's one of the objectives that I have.
Yeah.
So, I mean, you mentioned knowing the community really well as being important for somebody who's going to start communicating via media. And I'm just thinking about pediatricians who may be watching or listening to this and thinking about getting into social media themselves. Like, what are other important things for them to think about besides knowing their listeners or knowing their community really well?
It's commitment. It's kind of having if you really want to create impact, everybody thinks that you open an Instagram account or an X account and everybody will start following you. And you only get your mom, your family members, and a couple of friends. And it takes a while. And the main objective of that is actually to create our voice. Because one of the things that I saw specifically during H1N1, COVID-19, and it actually continues to happen, is that if we're not out there, it creates a void. If us as pediatricians, we're not out there actually giving information and sharing and creating that conversation, it creates a void where a lot of misinformation, disinformation actually starts piling up. And, you start wondering, where is the truth? And I want to keep that problem and actually make sure that we are there. Sometimes the conversations are hard, sometimes they are fun, but actually being there is very important.
Yeah.
So it sounds like pediatricians shouldn't necessarily be concerned that somebody else has already made a video about immunizations. That doesn't mean that they also shouldn't speak out on the same topic.
I love the question. And the answer is we need to repost, share. And if there's a message that someone actually also did that is amazing, share it. Because if it's evidence-based, from a trusted source of information that actually checks all the boxes of evidence-based, that it's good for the community, let's do it. And the other thing is that it's very important that you're exposed. At the moment that you're going there, anything that you put in the internet will be there for life. Even if you delete it, there's like a footprint. Then making sure that you're okay with it, that the people that you represent, your voice and everything else are aligned with your objective of making sure that our communities are safer and our children have a better future.
You mentioned evidence-based, and I think about both, maybe pediatricians listening or parents listening. How can you know that you are following a trusted source, right? How? Because I feel like even I struggle with that, right? And so, what are your tips?
Oh, I love that question. When you go on media or social media and you have a white coat, that doesn't mean squat. Okay,
Sure.
That's one of the most important things. Then you need to figure out who is that person. Where is it coming from? Because it could be a doctor in philosophy, a doctor in economics, a doctor in medicine, a doctor in what? Then we need to figure out that part.
Yeah.
Then where is it coming from? The other thing is, if it's making you angry or very sad or like nervous and stuff like that, be careful, because that's the second biggest, most amazing red flag that they are trying to message you and actually bombard you with something specific. The third one, are they selling you something?
Yeah, for sure.
because it's like, oh my God, don't do this. But if you buy my book, if you get this potion, then you have that conversation as the third one. And the fourth one is trying to validate the information. Is it coming from, a trusted source of information, meaning, like a university, a study, and go a little bit deeper on where is it coming from. With those four things, at least you get like a true north, is it worth it? And most importantly, a fifth one is that on doubt, don't share it, don't touch it, don't like it.
Yeah.
Because the algorithm will start actually bombarding you with that type of information.
Yeah, actually, my family makes fun of me because they're a little more cynical than I am and skeptical. I think those are all great tips. I think that that idea that not everyone who wears a white coat, is a trusted source necessarily. So I really appreciate that. What are some topics out there that you feel there's a lot of like misinformation and kind of, now kind of thinking about how we can help direct parents to better information, right?
There's a couple of things that, and probably the problem is that they are so good that because of it, we actually have a lot of misinformation. And I'm talking about vaccines.
Yeah.
I worked and lived in Mexico City and in Mexico, and I saw when you have a population that it's not immunized. I saw meningitis, like real meningitis, and it was not viral, it was bacterial, with all the components and complications of it. I got to see from little pueblitos, what happens when you don't have, Haemophilus influenza B vaccinations, and compare it completely and contrast it to my residency where I didn't see a single
not one case.
Then it's a huge thing. Then having that conversation of what's true about vaccines and understanding and creating that path that parents want the best, no matter where you are in the spectrum in life, all of us want the best things for our kids. And when you have a parent in front of you that actually is asking questions about vaccines, that's not good or bad. We are the waiters. We need to encourage them to actually have that conversation and share the information that we have, the evidence-based one, the one where, when we have actually vaccines against polio went down. Because right now, none of us actually remember the iron lung. I didn't have one single patient in the iron lung. And right now I dread, summer because I need to be running around with my kids, not because they are going to be at risk of being 3 or 6 or 8 months in a hospital because of polio. Then there's a lot of conversation that we need to have and open that part. The other one is that we already know a lot of, things about like fluoride. There's a space there that makes a huge difference. Are we fluorinating a lot or less? Well, it all depends where you are. That's the first thing that I always tell my parents. And the other one is that how often or how direct you have contact with a dentist. Because, do we want to make a beautiful, clear, and clean life? Of course we want to. But we need to have preventive services. Then if we want to take away a lot of the public health things that we have, we need to make sure that every kid has a dentist.
Yeah.
And right now that's hasn't been possible.
Right. Absolutely. That's a great point. And I think that's where maybe people lose sight of kind of why public health measures are in place, like fluoridating water. Absolutely.
Are there any other issues that
you
think
friend,
are
I do
important
have
for
a
us
lot of
to
issues.
talk to social media about? You have many issues.
I have a lot of issues. On reality, this is the moment that us as pediatricians, we need to be out there. We're starting a lot of waves around the country, around the world, where there's a space to actually share what we're seeing, what we have learned in our trajectory as pediatricians, as physicians, to make sure that, families don't feel that they're alienated or we are the others. No, we're waiters for them. We're the ones that actually will show the menu, share what are the best dishes that we have that day, making sure that, if they have an allergy, to make sure that we skip that dish, and make sure that we're moving forward with the things that we have for our community. If not, we're going to lose the thing that we have lost probably in the past 4 years, our voice, our space, and most importantly, the thing that actually makes us happy as pediatricians, to actually have that connection with the family, to create a better future for our children.
Absolutely. Thank you.
Yeah, that makes me think about something else, which is that the parents aren't the only ones watching the videos on social media. The kids are also. And just thinking about, I mean, there are many issues for child health around social media, but I just wanted to ask about one particular thing, which is the kids find health information on social media. They watch videos about health issues, and they have a lot of questions about what they're seeing. Like, what do you tell the parents of the patients that you see about how to talk their kids through what they're seeing on social media related to health specifically?
I always tell them that there are 3 filters. The first filter is them, making sure that, open the conversation in a setting where it's neutral to actually grab the information that they're seeing, because we don't want our teenager or our kid actually in the room watching all these things and we have no idea about it. Then opening the door that whatever you see in any media, read, heard, whatever, we are there as parents for them. The second filter is actually the pediatrician. We're not just there to actually do preventive stuff, but also to encourage and kind of guide. We're not, we are experts in a lot of things and we can kind of guide a little bit more on the family part. At least if we do not know, we can actually at least let them, read this, get this, and do that part. The third one is making sure that we are involved with changing technology. And I'm going to invite myself for our next podcast on this one. But right now, our children actually live in 2 worlds that we've never had. One is actually the physical world. The other one is the virtual world. Then the physical world is the one that we were born at. And the virtual world is the one that we are starting us as parents, as pediatricians, to understand. But they were always attached to a screen, to an internet device, to all these things that actually make their lives different. Then,
Yeah, absolutely. I think one of the things that I see in my office when I talk about phones, and I always talk about how my kids aren't going to have a phone until high school, and the parents who are also doing that are so emboldened. They're so empowered by that their pediatrician is doing with the choice, and the kids in there are like, oh, I guess that's good for me. Yeah, totally. I also want to put a plug in for the AAP Healthy Children website. They have a family media plan creator, and so you can customize it to your family, and it's something that is on my to-do list to do with my family as I have a teenager and pre-adolescent. So I think it's an important thing to think about.
And now that we're talking about that one, they also have the Center of Excellence in social media and mental health. Then that's another amazing resource, because we're learning as we go. This is something new for everybody, and there's a lot of resources on the media aspect of it, on when to give the cell phone, because they actually do have a lot of answers, and I'm not going to tell you anything until you go to the website. And there's tools there for pediatricians and also for parents.
Yeah, awesome. And the AAP is one of those trusted sources that we absolutely go to. Well, thank you so much. This was awesome. What a great conversation we got to have today, and hopefully it was helpful for all our listeners.
Thanks for joining us.
Yeah. That was a great conversation. And I had no idea that we shared that Chicago training, but I really liked talking about kind of trusted sources, making sure that we don't leave a void in social media as pediatricians.
Yeah, Melissa, I really appreciated the idea that really any pediatrician can get involved in producing social media content that can be educational for children and families.
Yeah, well, with the right level of commitment, right?
With the right level of commitment.
You can't just go on there for a couple posts.
And knowing your community.
Yeah, absolutely. And then, I don't know, I love that we kind of closed it out talking about the impact of social media on kids, and good trusted resources like the AAP and the Center of Excellence.
Yeah, it's a difficult time to be a parent and helping kids navigate social media, especially when they're learning about it faster than we are.
Oh my gosh, so fast.
And it's really great to have pediatricians like Ilan who can provide us with tips on how to help our kids navigate that and help families address that with their kids.
Yeah, absolutely. Thanks. This was so fun.
Yeah.
Thanks for joining California Pediatrics. It was a great conversation today.
Please leave any comments or questions you have in the comments section below. Thanks for joining us.